When I entered the program, I had no idea what a dietitian does. 5 years later, I'm still learning what a dietitian does.
This is the program where you're going to get that personalized experience. You're going to get a practicum that's tailored to you, and you're also going to get that coursework that's going to give you the background.
It's just a unique program that fit with my goals for what I wanted in terms of my work placements.
It really allows you the opportunity to specialize in an area of nutrition, but then also get your master's and also become a dietitian, which is really great.
The goal of our accredited Option 1 practicum of the MHSc program is to really prepare students for dietetic practice. So our curriculum is really geared to meet dietitians' needs. Students become adept at understanding and interpreting scientific evidence, which is the foundation of practice-based decision-making in dietetics. Our courses give students opportunities to understand and apply adult education theory, principles of universal design for education, flexible learning and communication strategies that really meet a wide range of audience needs, including people living with disabilities.
I think the master's really steps up your game in terms of your confidence level. A lot of our coursework really prepared us for the work placements because it was so self-directed.
I came in having done my bachelor's degree and not really feeling like I could go out into the real world and be a dietitian. And the coursework, those 2 semesters, really set the foundation that gave me a lot of the skills and the knowledge that I was then able to apply in the practicum. It's like how to do a systematic literature review, how to write for a specific audience, knowledge translation, strategies of health behavior, all of these things that I really took with me into my practicum.
The MHSc students engage in an 8-month practicum following their 2 semesters of coursework. So the practicum has a variety of different placements where students meet the integrated competencies for dietetic education and practice. It's like working a 9-to-5 job. So they go and work the hours of their preceptors. They do the tasks that their preceptors would be engaging in, and they really work alongside dietitians and other allied health professionals to engage in the work that dietitians do.
You have some really unique work opportunities that could be your calling.
And one of my preceptors was talking to me and she said, "Sorry, I keep forgetting that you're a student. I keep thinking that you're a colleague." And I kind of sat there and I thought, I feel like I work here too. And it was really great to have that feeling of I can actually do this job.
So in choosing the practicum, students are required to complete certain placements in areas of nutrition care, population health, and management. However, the diversity is really vast, so if students want to engage in more hospital-based practicum, then they can. If they prefer to work more in the community or in industry, we also look at these factors in order to make sure that they're placed in areas that they prefer.
I couldn't have gotten the experience that I was looking for at a hospital internship program because I knew specifically that I wanted to be working in the community for most of my time. So Ryerson really offered that to me.
There was a lot more flexibility in terms of me potentially being able to direct where my work placements were, how long I could be where.
It's really great when you know what you'd want to do, but also if you don't know what you want to do at the end, because you can experiment with different things.
Megan was able to kind of take our preferences, our desires, what we wanted to learn, what we were interested in, and what we needed to learn, and kind of put all of those together so everyone had this really unique experience.
Part of my job is getting to know the students and what their personalities are like, and then matching them with preceptors where I know they'll have a great experience.
Megan was my friend, my therapist, my everything during the practicum.
She really takes the time to get to know you.
I've emailed her and she always responds. She's willing to set up a phone call or do whatever you need to really make you feel like you're moving forward and you're going to be successful in the program.
If you're struggling or you're having emotional challenges with your coursework or with your internship, she'll really guide you through that process to make it easier on you.
There is a lot of flexibility in where students are placed, and also we focus on student preferences and their ability to travel. So if students prefer to engage in placements closer to their home, where they'll likely be working when they finish the program, I look for opportunities where they can save a little bit of money and create networking connections.
And you get so many opportunities to go from workplace to workplace and meet so many people that there's absolutely the chance of networking and having job opportunities when you're done, which is really amazing.
Well, this day and age, getting a job, all of it's networking.
Someone like me who kind of didn't know where to start, who do I talk to, these were great opportunities to actually be able to meet other dietitians and be able to connect with them.
Networking in dietetics is very important. At Ryerson, you start to accumulate that network by working with your fellow students.
We really talk about how to network with each other and how to maintain that great circle of friends that you've developed over the course of the program.
I was lucky to get employment very early, and I would send jobs we had a group on Facebook, so definitely that was our first network. We kind of all shared things with each other even after we graduated.
Having such a close group of students was actually one of the highlights of the program for me. As we move on, I think we're all going to keep in touch and keep supporting each other.
I'm really passionate about my job. I love watching the transition that students go throughout the 16 months of the program, and it's really rewarding when at the end of the day 20 students graduate and become dietitians and really join a field that I'm so proud of.
It means so much to me to be graduating, and everyone was really emotional today.
It's just like a weight's lifted off of my shoulders, and now I'm ready to take my schooling whatever direction I want because I feel like I'm ready.
I would recommend the Ryerson Nutrition Communication graduate program because it offered me a sense of community, the skill sets that I needed in the area that I wanted to work in. And to me, the most important thing was that they really valued us as individuals with our individual career pathways.
And I always recommend the program. I would say 100%. You're going to get a unique experience. It's going to be tailored to you. You're going to be able to get that hands-on experience, but also have the skill set that you need to kind of go out there and do it.
I think it's wonderful. It's really personally changed my life, and I'm really happy of how far I've come since the beginning, so it's been really, really nice.